Hi, my name is Victoria Cavan, and I will be talking about phlebotomy. What is a phlebotomist? A phlebotomist is the surgical opening of a puncture of a vein in order to withdraw blood or introduce a fluid or part of a procedure of letting blood. I spent 4 years at Sarasota Memorial as a phlebotomist and 6 months at Florida Cancer, and pretty much it all deals with the same thing of doing a blood draw. You clean the site and then you insert the needle and you do the order of draw. It's a very different job than what a nurse does. A nurse can do phlebotomy, but they only do a few weeks of the class, so it's different than any type of IV stick. Why is it important to the healthcare? It's very important to the healthcare because of many reasons. One of them being the chain of demand. If a doctor orders a CBC, which is a complete blood count, that can show if a patient is anemic or if they have a certain type of cancer cell within their blood. That leads to a blood test being able to diagnose a patient within minutes of being drawn and tested. Usually after being drawn from the patient, a test usually takes about 3 minutes to get down to the lab, and it takes about 5 to 10 minutes to be tested, or it can also be a send out, which can take 3 to 5 days to be tested, and those are like an HIV test. They try and get those out on ice, so it's very important. Also, something else that's very important with the chain of demand is the patient identification. If a phlebotomist is drawing the blood, they also ask for 2 identifiers, which is usually the full name and the birthday. I know at Sarasota Memorial, we would also do the last 4 digits of their ID band, which we would read the last 4 digits off their band and then also just say it out loud 2 more times. It's very important to use this patient identification and be very secured about it, because if it's the wrong patient and you're doing the wrong test, that patient now is diagnosed with a certain blood type and certain diagnosis, which can lead to serious more problems. The laws and risk, as you can see here, we have HIPAA, which is, for example, if Bob Marley came into the hospital and the phlebotomist goes in there and they came out of the room and they were telling everybody, hey, I drew Bob Marley's blood, that person as a patient can take the hospital to court because that's against HIPAA law. HIPAA is pretty much saying that the patient has the right of privacy and much more. HIV and AIDS, that's a risk. For instance, if one sticks themselves while going into a room, that risk that, if that patient has HIV or has AIDS, then that could be a contact to yourself. I actually had that situation happen. My 2nd week of working at Sarasota Memorial, I went into a room and the patient was combative. I asked the nurse to help me, which was very nice. And she came in and the patient was still really rowdy. I stuck him. He then bumped me and I stuck myself. I had to do a 3-day course where they drew my blood. They mail up, went and drew his blood again because they had to test a different type of test that we already took. And then they tested him for any type of STD, HIV, AIDS, all that stuff, and then 3 different days they tested me to make sure I didn't have anything. So it's just a safety precaution. It's very, very great to have. Another important thing is PPE, which you can see here. PPE is a personal protective equipment. Us in hospital have it. People that are in constructions have it. It's mostly a hat, eyewear, a mask, and a gown. We use these for rooms that are airborne, contact, and droplet. Airborne is a bacteria that you can get if you go into a room and the pathogen is actually airborne. So if you breathe it in, then you could have that pathogen. Contact is this touching, if you touch a wound on a wound, then you'll possibly have the pathogen that they have. And droplet is if the patient is coughing on you. So you want to always make sure that if the patient has something that is possibly one of those 3, that you're using the proper PPE. Everyday PPE is definitely gloves and scrubs. You always want to make sure that you're always wearing something protective, because you never want to take something home. So phlebotomy is a very important job. I believe it is to many hospitals, many doctor offices, and so on, just because drawing blood is a very, very difficult job, especially when it comes to children and everything. It's been a long shot for me. I've been doing it for a really long time. Just as a doctor's job is important, a phlebotomy's job is important. And the nurses, the doctors, the patients, they all appreciate everyone's work, especially the phlebotomists. So that just makes the job 100% better. And it's important that if you are in interest in phlebotomy, that you hit up your local community colleges, because that's usually where you can get your degree. Well, it's not a degree, but your certification. It's usually like a 6-piece class. Or you could also take a medical assistant certification and degree and have the phlebotomy with it. Well, that is the end of my first speech with this class. I have my reference right here. I just want to say thank you and have a great night.